Well, greetings, everyone. My name is Eugene Dean, and tonight I'll be your host for the Beyond the Pandemic Media Conference. This is part two
Well,
of a
greetings,
media
everyone.
conference that we
My name is
started.
Eugene Dean, and tonight I'll be your host.
My apologies for that. Let's try that again. So, greetings, everyone. And my name is Eugene Dean. Tonight, I'll be the host for the Beyond the Pandemic Media Conference. This is actually part two of a media conference that we started last month. And we had so many questions that came in from the broader community that we weren't able to complete all the questions in the first session. So we decided to gather all the health professionals from our first series back together again so that we can allow all the questions that we received from the community to be answered. So tonight, I would like to welcome. This evening, we have Dr. Henry Darling, we have Dr. Sifu Reginald Can, Dr. Amne Asaran, we all have Michael Watson and Sophia Cannonier, and we also have Dr. Connie Frith. So thank you guys very much for joining us this evening. We really appreciate you having you, and I'm sure the community appreciates you being involved as well. So yes, and so for anyone who is in the audience, we're first going to try to get through a number of the questions that we have. But if you do have any other questions, you can email us at info@beyondthepandemic.tv. And if you've joined us this evening and you've yet to see any of the episodes that we've produced, then please visit our website, which is www.beyondthepandemic.tv. So tonight, our talking points are natural immunity, ivermectin, the hotel quarantine, health and wellness, the government vaccination program, adverse effects, and informed consent. So we did get a chance to talk a lot about natural immunity the last time. We talked quite a bit about ivermectin as well, but we still had a lot of questions that remain unanswered. So we're going to jump right into it. I'm going to put up the first question. This is relating to ivermectin. And it's, how do you go about ensuring that every single person in Bermuda and the planet is not immunocompromised in your effort to resist the vaccine while promoting an alternative unapproved drug and treatment plan? So this is directly related to ivermectin. And so Dr. Darling, would you be interested in saying anything about that? We do have some comments from Dr. Flood, who was unable to join us tonight, and she sent her responses, but I can first let you speak to that a bit.
It's an interesting question that is written because in itself it has certain incongruities here. For one thing, you can't ensure that every single person is not immunocompromised.
Yeah, they already are.
Some people's immune system is really good. Some people's aren't. Most time when a particular drug is being introduced or a particular way of treatment is being introduced, they're going to kind of base it upon what we call the bell curve, the average person who is out in the community. So, and the average person's immune system is usually what they're potentially going to base it on. Obviously you hear a lot of times that they're also thinking of all those people who can't take the jab for whatever reason. That's why those who can should. But once again, establishing exactly who is immunocompromised. And basically all that means is that their immune system is not able to either be strong enough to resist a infection from the virus or the vaccine for that purpose. And so either person is potentially going to have issues having either illness from the virus or side effect from the vaccine, or even a positive effect from the vaccine. We're hearing more and more now. In fact, I think I just heard tonight about America will definitely be introducing a third vaccine shot to its regiment, based upon the fact that Israel's most latest data is saying that they see waning immunity in those who took the COVID vaccine early in January. And they're now seeing more and more of those breakthrough cases coming from those people who took the shot early. So there's obviously a waning effect, which everyone knew. It was just a matter of you didn't know how long. It's not necessarily that they have a bad immune system. It's just that based upon the way this vaccine works, we knew it was not going to be forever, and now they see it. They're not necessarily saying the same thing for those who have caught COVID, but we'll see what the data shows.
Okay, thank you very much, Dr. Darling. And welcome, Dr. Peets. Thank you for joining us as well this evening. I'll take the opportunity to share the response from Dr. Flood. So, like you, Dr. Darling, she said, okay, this question is not confluent. Who said that every person in Bermuda or otherwise is or is not immunocompromised? What is meant by that statement? Immunocompromised means a faulty immune system. Those persons may not mount a response upon being vaccinated. No one asks that question during mass vaccination efforts where medical histories are not taken. No one is checking vaccinated persons to learn whether or not their immune system has responded. This is one of our contention. How can the success of a vaccination program be truly measured without these kinds of follow-ups? So that's the response that came from Dr. Amani Flood in reference to that same question. So let's move on to the next one. The health and well-being of individual persons in the middle of a fast-moving global pandemic that was and is killing people at random is a very difficult thing to manage without global effort and support. Do you feel all people should rely on their own health and immune system to survive this?
Yeah, you should rely on your health and immune system, because even if you get a vaccination, it's your health and your immune system that mounts the response.
Mm-hmm, mm-hmm. So yeah, so that is very critical in this, because what we want to avoid is people feeling like because all of a sudden they have had the vaccine, that all of a sudden they're just scot-free. Like that's the only thing that's necessary. It's a concern that I've always had, where efforts constantly push towards external things rather than focusing on the health and wellness of the particular individual. So anyone else have any comments about that? Oh, just 1 second. All right, Sifu.
Good evening. I think that's sometimes a false sense of security, because they think because you have something available that you can forget about, as you've heard me say many times before, the constitutional health. And without your constitutional health, no matter what you're taking, that means you're building a house on weak ground, so to speak. So yes, with all the external things that are available, you cannot ignore your primary base of health or constitutional health. So as I've said many times before, I hope I'm not sounding like a broken record, that we need to integrate not just the external factors, but also have a look at the internal factors. So if you have someone that's not in good health, and all they think in their mind is, oh, great, I heard there's a vaccine available or some other medication available, and they think or assume that they just go to take that and everything will be okay as you alluded to. So yes, that also has to be looked into. In conjunction, at the same time, we need to look at all these things together and put them all together in a comprehensive approach moving forward.
All right. Thank you, Seafood. So let's see what the next question is. Why would one seemingly want to promote ivermectin over COVID vaccines, which is only FDA approved for intestinal strongyloiditis, and onchorciasis? Maybe the doctors can help me with the pronunciation.
Just say parasites.
Okay, thank you. I can say that. So, which is only FDA approved for parasites, but not approved for COVID. Yet promote COVID vaccines that are also approved by the same FDA organization for emergency use authorization due to a raging pandemic that has killed millions. So in other words, why would we promote, something that's not approved for rather than something that's been given emergency use authorization? So I'll start off with what Dr. Flood had an answer here for that. So her answer is there currently is no fully approved treatment plan for COVID-19. Therefore, any treatment that anyone receives can be considered an alternative plan to allowing them to go untreated. The FLCC treatment protocols that we support are equally as valid as any treatment given by anyone for COVID-19. The fact that COVID-19 is a fast-moving global pandemic that is killing people at random is the very reason why we should be throwing everything we've got at it. That easily includes ivermectin, a 40-year-old award-winning medication with a proven track record for safety and is swiftly gaining traction in proven efficacy. That's from Dr. Amani Flood. Dr. Darling, anything to contribute to that?
Well, I personally don't know of many people who would say that they promote ivermectin over COVID vaccines. I have never in my patient load, and I know very few physicians who would say, oh, there's no way I'm going to tell somebody to not take COVID vaccines. That's not our role. Our role is to give people the information on what we know, try to answer questions that the patient knows, and then give them the possible alternatives that are available. So it's not either or, it's one and the other, and then give them the scenarios of which one might be more applicable over another. But there's nobody that I know of that would say that if they know for sure that a vaccine works, that they would say still don't take it. Right now, the biggest problem is we know that the vaccine does help certain populations of extremely vulnerable people. We're not sure about the others, and to the same extent, if there is possibly long-term side effects or even certain short-term side effects, which we are constantly being made aware of, that people need to know. That's all. People have a right to know everything, not just part of it. And so, ivermectin has been around for 40 years, as Dr. Flood said. So its track record is well established, well proven. And just because the FDA has not approved it for emergency use of against COVID-19 doesn't mean that it can't be used or that it shouldn't be used. It just means that the FDA hasn't been convinced yet. But, the FDA was convinced about remdesivir. And then remdesivir was no longer convincing after it came out on the market. So it's not that the FDA is infallible. You have to be very clear about that. And neither is any government infallible. So if you think that you are willing to stand behind one and only one treatment, then you're going to do a disservice to your population. We can't afford to do that because, like they said, yes, there's a lot of people who are getting sick. There's a lot of people dying. And the World Health Organization, before even the vaccines came on the market, was quoted as basically saying, listen, these are hard times. We can't sit by and wait till every I is dotted and every T is crossed. We need to make anything and everything that is possibly in our basket of goods work for us. Give us something and we will look at it. And even if it's not 100%, as long as it's showing some kind of benefit, then we will give it a try. And it wasn't until after the vaccines came on the market that everyone started to pull back from that statement. But that statement has not gone away. That statement is very true. Ivermectin might work for some people, it might not work. But the question is it going to harm anybody over what you can claim that the vaccine will either help or harm? And the answer is no. Plain and simple, no.
Thank you very much, Dr. Darling. So let's go. The last question about ivermectin. Was the FDA right to approve ivermectin for its specific use and wrong about approving emergency use authorized vaccines for COVID? That's a very direct question. Yeah.
The two are not, ivermectin was approved 40 years ago. There was no COVID-19. How can you say it was, were they right to approve it? It was quite right to approve it for parasitic infections back then. Right now, it's wrong about approving EUA vaccines. No, I mean, emergency use authorization is just for that, emergency use. But they're not saying, either make every single person take it or else. That's a whole different statement.
Right.
I'm glad that they put the emergency use out there for those who really wanted to take the opportunity to have a vaccine that may prove effective, even though it wasn't fully vetted yet. Shoot, I wish I had some drugs sometimes that was able to give me that opportunity under different circumstances. So,
right. So, Dr. Dr. Flood had one last comment that I would share. She said, only by looking at the research on ivermectin can it usefully be fully appreciated. Ivermectin cures COVID point blank. Not every single case, but the vast, vast majority of cases where it is used, particularly when it is used early in the disease process. The evidence just keeps piling up. It works against all of the variants that have shown up thus far. It works on young and old. It is safe, cheap, inexpensive. We know why the FDA have not approved it, and it has nothing to do with its efficacy. It has to do with money and politics. It is not a contradiction to promote vaccines while supporting ivermectin. In both cases, the FDA are wrong. And yes, the FDA was right to approve ivermectin for its use against internal infections. The FDA have been right innumerable times and wrong innumerable times, such as when they approved the thousands of chemical additives in our food and personal care items. That's from Dr. Amani Flood. Okay. So we're going to move on to mandatory hotel quarantine. This has been a very popular topic for most people in the country. So this is the first question. If you become ill in a hotel, what care plans are currently being offered to people? This sounds like a question for our government, but maybe one of you would like to touch on that.
I'm not aware of a care plan.
None. I haven't heard anything.
Yeah, I'm assuming that they can call their doctor. I mean, yeah. I'm hoping they're not literally in prisons, that's for sure. So
right. Well, I would say, well, go ahead, Sophie. I say this has been one of the puzzling things. I know that we've had numerous conversations about how this kind of goes against everything that all of you have learned or experienced in your practices, because you've basically gained knowledge to treat, you know, and for us to have such a serious situation without having like treatment plans in place, just raises a lot of questions and red flags. So, Sophie, did you have a comment?
Sure. Mandatory doesn't mean law. It just means a suggested rule. Mm-hmm. And when we were under house arrest, which was not mandatory quarantine, there was no call to find out how we were. No one checked in on our health. In fact, we didn't have the opportunity. It wasn't suggested that we take care of our health because we didn't get the day 4 or the day 8 tests. So people who are under house arrest or in the hotel, they do not get any calls to check. They are not provided with a thermometer at all. It's not suggested that they purchase one before they fly. No one checks. And the food, if there's a steward of health that is telling you that you need to be in house arrest or in a hotel, they should be monitoring what you're eating and the quality of the food. And if they're putting you there, they should be paying for it. And in fact, what we know is that no one in hotel quarantine, or whatever you want to call it, is paying. There are lots of people who are not paying. There are people who might be, and hopefully they will get their money back. But the majority of people are not paying for the hotel. Do you want to add anything?
Yes. I'm sorry. Were you saying something, Dr. Asaran?
I wasn't, but...
Oh, okay. Well, I was going to say...
I was going to add something.
Well, in support of what you said, Sophia, we had some people doing some research, and they found that at least 80% of the hotel stays have been covered by the government. And I think it was just released in the newspaper recently in an official statement that close to $250,000 of taxpayer money has been used to cover those costs. So yes, Sifu.
Yeah, not knowing what the plans were, but I would like to make some suggestions for moving forward for any future quarantine persons, that you should formulate your own plan, knowing that you're going to have to quarantine upon returning. I think you should consult your doctor, let them know that you're going to have to do this. You should also gather your supplies of your vitamins and minerals or what have you, even your own food snacks that is help to sustain you. This is just some suggestions, having seen this question myself for the first time. Because a lot of times people are not aware, and as with most things, to be successful, you have to have preparations. So I'd like to just add this suggestion that knowing you're going to have to quarantine, I behoove you to contact your doctor before you return to Bermuda to let them know this is what you're going to have to do. Is there a number that they can call if they fall ill inside the hotel room? What type of measures that you can put in place, even with family measures that they could be checking on you and so forth. This is just some basic guidelines, having seen this question also myself for the first time. And yes, take your own snacks, take your vitamin C, your zinc, your D, and so forth with you to the hotel, because obviously they're not going to bring it to you for you. Because we have to also protect ourselves going through this journey as well, not just depending on somebody else outside of us or waiting and hoping. Preparation is key.
Right.
So Eugene, can you hear me?
Yes.
All right, so that brings to bear one really super important point, and that is, we all know that we have to take personal responsibility, but sometimes understanding, well, what does that responsibility look like? So if we're under the mandate of having a mandatory quarantine, I think it behooves, and potentially we have officials who are are watching and listening, I only know of a few people who personally have indicated that they have been in the quarantine process. And if you don't kind of like have a guide, that means you don't really have that kind of knowledge. So my hope would be that if however long this is going to continue, is that people don't just, let's say, plan on their own, but just receive some very, very specific guidance, as Sifu has just said, so that I know if this is the expectation of me, here are some of the things that are going to be helpful for me to kind of like exercise. And I have one question for the doctors, and that will just be the medical doctors, and that will be just this. Let's say I do test positive for COVID-19 and I show signs. I would like to know, what take me through the treatment process of how they would sort of. I know that they'll take my personal medical history, but let's say, do I have to say to them, because of the ivermectin scenario, do I have to say to them, this is something that I would like to have as a possible treatment option, and is that treatment option available for them today?
Dr. Osram, you want to answer that?
Any patient who have symptoms starts with the same process for everything. You take a thorough history, you examine them, and you make your plan based on your examination findings. And I ask my patients, like, what type of patients they are. So are they patients who prefer natural methods? Are they patients who would like to be treated with medications? And if they are interested in ivermectin, I don't have a problem prescribing that. And it's an approved medication, so you write a prescription for it. I think when people are asking that question, it's probably because they have heard about the difficulty when patients have been hospitalized, which is a different scenario. So it is available. You can prescribe it. You can get it if it's available in the pharmacy, and we wouldn't have control over that. It's availability.
So if I'm not admitted to the hospital and, not in the hospital scenario, in my own domain, working with you in my office, in your office, do you have access to be able to assist me?
Access, we are allowed to prescribe medications. It is a prescribable, approved, available medication. I think I don't know why, but it has been demonized by the community and misinformation has gone out about ivermectin. We use medications that are not approved for specific conditions all the time. Gravel is the same medication as Dramamine. It has a different name. It's a similar thing. We're using it for a new use and it's effective in that use, but that doesn't mean that it's a made up drug or that it won't work or that quacks are prescribing it, amongst other things that we've heard about it.
All right. So give thanks. So let's go
Before,
into the.
Eugene, before we go on, I feel sometimes I talk a little too much, but this is I've seen where this can go south really quickly, because patients a lot of times can feel disempowered if they go to a doctor saying, I'm concerned about this, and the doctor either just totally ignores their concern or basically will say, listen, there's no studies that prove this. I'm not comfortable giving you this medication. Here's the line. If you're thinking that you have COVID, go get a test. If the test is positive, you call your doctor. You say, listen, I got a test back. It's positive for COVID-19. I would like you to prescribe me some ivermectin. If the doctor kind of gives you, I don't know what you're talking about, or no, you call another doctor. You call around as many doctors as you can until you can find one who will write that prescription. Because once you enter in that hospital, you will be limited by your choices. Your choices will not be your choices. Your choices will be the hospital's choices. And right now, the hospital does not choose ivermectin. If you wait till you're sick enough to go to the hospital, you might have waited too late. You might have. You might not have, but you might have. Why take the risk? Nowadays, with this third generation of COVID, it can be cough, it can be diarrhea, it can be anything of the above. But if you are now giving a sign that you're sick, you can't clearly identify that that sickness is not from COVID, go get a test. And if the test is positive, you find somebody who's going to give you ivermectin, and you find somebody who's going to give you enough of it to actually treat you and not just sprinkle a little bit on you and think they've done a good service for you. This new Delta variant needs a lot more. And if they underdose you, it might not work. And if they overdose you, it ain't going to harm you. That's the reality of what we've seen. That's the reality of what the literature is showing you. And in the end, you just don't want to get sick and die. Do not wait for somebody to kind of point their finger and said, I told you should have got a vaccine. I don't care who that is. I'm not here to make friends with my colleagues. I'm here to keep people safe. That the time for conversation of vaccine versus not vaccine, at that point, it's over. It's treatment of COVID. Let's get it done. Plain and simple.
Yeah, thank you very much, Dr. Darling. Yes, so just moving along, is mandatory quarantine in a government designated facility preventative punishment because people might skip on voluntary quarantine at home? Yeah, this is not a medical question, so to speak, but obviously something that people are talking about. Anybody have any comment on that? Or
No, the quarantine at home is not voluntary, so this question is a bit awkward. The quarantine at home is also mandatory. I can't say the reason for it in terms of is it preventative punishment? I don't know. But my opinion on it is that if you are quarantining people because you are concerned about spread and you are trying to keep things in place for the greater public health good, then quarantine everyone. I don't think that people should be separated, especially since we know that vaccinated people can develop symptoms, can contract COVID, can transmit COVID.
I agree totally. Dr. Asaram is speaking from the nothing but the truth, the whole truth, and nothing but the truth. We were very early saying you're not going to be able to distinguish between the vaccinated and the unvaccinated, especially if they're coming back positive. You're not a positive vaccinated person is going to spread it, and they brought out every scientist they could to back up that it couldn't. And now where are we? We're what, a couple of months into this of making people quarantine. We now have, as of tonight, 52 new cases, with the government saying how they're going to even crack down harder. How much harder can you get when you've already quarantined the unvaccinated? Obviously, the unvaccinated flying in didn't do it, so somebody else has been bringing this in. So, that was all punitive and not based upon science, when a lot of the other countries, as Dr. Asaram said, was saying, okay, well, either going to quarantine you or we're not going to quarantine you. Not this kind of just for this group and not for that group. We didn't know that the science wasn't clear. They had no business doing that.
well, yeah, and so what's emerging also around the world in world news is obviously the CDC has come out and made it very clear to everyone that they've changed their guidelines now because of what Dr. Asaran just said. And they say, no, it's a fact because we're not, being presumptuous anymore. We're looking at actual data, and the actual data is showing that the level of virus in someone who's had the vaccine and someone who hasn't is actually the same as it relates to the variants that are being discussed now. And, even our local stats, when we look at the numbers, and because 90% of the persons traveling, have already had the vaccine, then you're absolutely right, Dr. Darling. And the data again is showing, I think the numbers in a recent report was showing out, 70 of the cases were all from persons who had already had the vaccine. So it's very interesting that when the changes were made to the quarantine policies, that they were only made to persons who hadn't had the vaccine, when the new data was showing that the changes should have been made around persons who actually have had it. And going back to what I think most people in the country have been saying is, let's just remove the discrimination from the mandates. So
Can I add something in there?
yes, sure.
Good evening, everyone. Yeah, I think the key word here is reasonableness. And I think whenever you take a community and you start to squeeze them, and you disenfranchise or you separate a portion of the community, and you start to squeeze them harder and harder, there is no reasonableness within that situation. The question talks about, are they going to skip voluntary home quarantine if the government don't pursue this hotel quarantine? Well, if you've got 14 days being locked up in a room, even though you can demonstrate that you are healthy throughout the whole 14 days, that is unreasonable. And the government's persistence on not allowing people in quarantine to test to find out what their status is means that they're required to stay there for the 14 days, even though they may be negative the entire time. I mean, that's ludicrous that you cannot allow an individual to test their status to find out. Now, something that happened really interesting at the Euros recently in the football, they had players during the Euros that tested positive on particular teams. They were isolated, but then what they did is they continually tested them until they came back negative, at which point they were able to rejoin the bubble or rejoin the team, and they were able to continue. Why have we not seen this in the hotel quarantine? If I go in and I test negative on day 4, I have an arrival negative and I have a pre-arrival test negative, then surely reasonableness would suggest that over that time frame, there's pretty much 8 days that I tested negative. Should that not then be my get out of jail card? I can flash that card and say, look, I've actually been negative for 8 days, and therefore I no longer need to be required to stay in the hotel. But they're not doing that, so it becomes and feels punitive because now you're required to do the full 14 days, and nobody's checking on your status. They don't care if you're healthy, unhealthy, regardless. It has nothing to do with health.
I mean, that's another thing. If you consider I can't think of any conditions where we go out searching for illness. You're either fine or you're ill, and when you become ill, we manage you. We give you forms of treatment and advice and monitor you.
Pregnancy.
It doesn't seem that
We look for illness in pregnancy.
yeah, but then pregnancy is a state where you're monitored anyway. So I'm talking about people who are perfectly fine, just saying, come and get tested to see if you have this.
Right. To see if you have gestational diabetes, to see if you have group B strep. Pregnancy.
Right.
But in terms of this respiratory illness, we are out searching to see if you have COVID, to see if you're ill. We might have a better use of resources and health options managing people who are ill, as opposed to managing people who are perfectly fine.
Right. All right, let's keep moving along. If the intent is to prevent community transmission, then how are the current rules achieving that when we let vaccinated travelers free to roam amongst the community after a negative arrival test? Well, I think we kind of talked about this somewhat already. There was more commentary to this statement just saying that non-vaccinated individuals are 20 times more likely. The government said that non-vaccinated individuals are 20 times more likely to test positive, but there are 40 times more vaccinated travelers, which means still we can expect double the amount of positive people from vaccinated travelers as a group than from non-vaccinated. I'm not sure. Are you aware of any of your already data that says why non-vaccinated individuals are 20 times more likely to test positive? And also the thing that I know has been a question that has come to me a lot is why are vaccinated persons even allowed to go home even when they test positive on arrival? Any comments, or have we already talked that enough?
I mean, I don't. Somebody's asked me the other day whether or not a vaccinated positive person has to go home and quarantine for the full 14 days. And even if they do, then once again, what you're saying is that possibly infected person has somewhat more the ability to stay home than a unvaccinated person. Somehow the vaccine makes you trust that person
Trustworthy.
more
more
than the
compliant and
unvaccinated.
more trustworthy.
It has nothing to do with the disease state. It just simply has to do with whether or not you're vaccinated or not, which becomes punitive again. And not, you got to remember, before we used to quarantine in the old days, we quarantined sick people. Now we're quarantining well people until you prove that you're not sick.
Right. That's what I was saying.
Yep.
Right. And then when you throw on top of that the fact that a number of studies have been done about asymptomatic cases, period, then that throws another thing into the ring. And that's another hot topic. But we have a lot of questions to cover, so I don't want to get held up on every point. So this is the first, let me take that off the screen. This next question, I need to read a bit. And this is, I guess, not necessarily referencing yourselves directly. Maybe this question is suggesting that you're implicated because you're speaking. It says, many within the resistance movement seem to push hard against the mandatory hotel quarantine on legal and moral grounds, stating that people should be trusted to go home and remain in their homes so as to avoid costly hotel stays. Even after that same seeming choice resulted in the deaths of 20 more Bermudians during our last quarantine by one person entering the island and not following the protocols put in place.
There's zero proof of that claim. Zero.
Yeah.
And that was going to be my first question.
There's zero proof of that. So I don't know where they got this information that one person is responsible for 20 deaths, but there's no proof, there's no data, there's no study, there's no test, there's no measurement to suggest that that is true.
Right. Yes.
Even if it is, though, how do you say that some positive vaccinated person can't do the exact
same thing? Precisely.
Right. Right. When the data clearly shows that vaccinated persons transmit the disease.
Exactly.
That's the same. Yes.
That's why you remember the whole thing about getting vaccinated was, we don't want you to kill grandma. They're not saying that anymore, because vaccinated or not, you can still kill grandma. So now they're saying get vaccinated so you won't go in the hospital or you won't die, because now we're all worried about killing grandma. Hence why the CDC has said, put your mask on. I don't care whether you're vaccinated or not, because you all could be spreading disease to grandma and killing her. If we want grandma not to die, give grandma the vaccine.
So again, and I don't want to dwell on this too much, but has anyone ever experienced any other scenario where you taking a treatment or medication is done to help someone else? Has that ever been a scenario? Can you draw on any other experience with that? Because
no.
Yeah, so that's very interesting, because that whole scenario about you taking something to save your grandma or someone who's immunocompromised, or that's just very, very interesting. Sophie, you had something?
Maybe something like gonorrhea. If you are your partner or the partner
take that to cure yourself, and your partner is advised to take it for themselves.
Okay.
You don't take it for your partner.
Yes, exactly.
Cool. Doctors know.
Okay, cool. Yeah. Yeah.
Maybe for your future partner. I don't know.
Right. Okay. So now this one, I think, Sophie, now the question, well, it's still a statement. We haven't gotten to the questions yet. But I think this is speaking directly to you and Michael. But when the two most vocal opponents of the hotel quarantine arrived back to Bermuda, they came straight out of the airport without masks and began to closely interact with media and surrounded members of the public with handshakes, hugs, and the holding of microphones. They were allowed to go home only to break quarantine rules by leaving their home. Doesn't this show exactly how home quarantine rules got broken by your own group? So I guess we're all lumped into a group here, and puts people's lives in danger. So just with that, I mean, that's a whole thing. Is again, as you said, Dr. Asaran, yeah, it's a lot that could be said about that. I don't know if Michael, if you or Sophia have anything briefly to say on that. I mean, that's almost like a whole conversation in itself.
Yeah, well, here's the bit that maybe a lot of people don't really fully understand about our decision, is that we had 2 children with us. And having experienced hotel quarantine from last year, we were on the airbridge flight that came back in April of last year. So we got slammed into the Southampton Princess and was stuck there for 2 weeks. I've done 2 weeks of quarantine in a hotel room. And part of our decision to do what we did was to say, we're not going to subject the children to that again. But that was based very much on our status, on our antibody status. We didn't do this in a careless, mindless way. This was very much an organized thing. We went out, we found our health status and worked with our position. But also the piece that people aren't really taking into account is the potential effects that being locked in a room can have. Now, we are at this point, as somebody pointed out earlier, you are presumed guilty. Yeah, you are thrown into that room, and although you may not necessarily feel you've done anything wrong, you take on a certain energy of, oh my God, I've done something wrong. I have to go into quarantine. So therefore, there's a presumption of guilt there. And to be in a room with 2 children, for me in that case, not being able to go outside, not being able to move, being a movement person, I value movement tremendously, and to not allow the children to be able to move around as well, very important to us. Not even have sunshine, not even have fresh air, daylight. So that was a big factor for us going into this. And yes, there was an element of this kind of civil disobedience idea, but it was a way to stand up against the system and say, there's so many factors involved in this. You can't just take somebody's status and say you are or you are not positive for COVID and then lock them away. There's so many other factors and elements to the health of the individual that need to be taken into account. And I don't feel that this government has taken that into account at all. They're too worried about killing grandma. Yeah.
Thank you very much, Michael. So I think we finally get down to questions. Go ahead.
Someone just asked if we could discuss why the age for testing has dropped to 2 years old.
Oh, okay. All right. So we take a note of that. Let's just try to get through this hotel quarantine. We can pick that up in about the government vaccination program. Doesn't this show exactly how home quarantine rules get and put people's? I think I said that already. So let's skip to the next one. And if the claim to justify this is that everyone was tested for antibodies before arrival and nobody was sick with COVID, then should everyone just claim that without factual knowledge? Now, I don't even know why that was asked, because you were tested multiple times and, had proof of it. So I don't know if you want to comment to that again, Michael, if it's just.
Oh, yeah. So we had the test first in February that came back with positive antibodies. We had a test again in May that came back with significantly higher antibodies. We've actual fact just last week gone ahead and had a 3rd antibody test done. We're waiting on the results for that. So we'll keep you posted on what those antibody results look like. Now, bear in mind, in the interim, we may have been exposed to COVID again.
Delta.
So it'll be interesting to see kind of how those antibody tests come back this time around. But again, we have bits of paper in our hand. Dr. Dowling is our doctor and has been supporting us through all of this. I think we've been doing our own research and wanting to to show, that natural immunity piece is something that people should be checking for. In the Times last week, I think it was Monday or Tuesday in the UK, they did a model assessment of the entire community in England, and their estimates are as high as 94% of people in the community now have antibodies, whether it be through infection or through the vaccine. So we need to get that status done for everybody here if we really want to prove this idea of herd immunity.
Yes, because herd immunity has historically included natural immunity. Not sure why it hasn't been included here, but herd immunity around the world has included natural immunity.
Yeah, when anybody goes away to university, you have to fill out a immunization status on a person, and usually what they ask is for either documentation of your vaccination or documentation of previous infection. And as long as one of those two are ticked and documented, they accept that as the going rule.
Yeah, and also a number of places around the world, America included, people have their antibody status in their passports, and that's being used for travel. So it seems like there are some countries that are picking and choosing whether they wish to deal with natural immunity in this instance or not. So here's a good question here. Does having antibodies stop you from getting and spreading COVID? Please provide data sites for this info.
I wouldn't say that it stops you from getting, but it's very much like what you're trying to achieve with a vaccination. Once you have antibodies, your body has or is figuring out how to respond to that offending agent. That's the nature of your immune system. In terms of data, I don't know, because for the longest while, no one wanted to rely on antibody testing. And then when we were doing the rapid test, then we pulled back and stopped using it altogether. And now people are getting back into checking for antibodies.
I think some of the most recent things that I've been reading have been based upon whether or not the antibody tests that we use are going to be accurate enough to give us an assessment of how well you are protected against COVID. Because as we've heard in other previous countries who have either decided not to mandate people in lockdowns and stuff, who wouldn't necessarily have high levels of antibodies, but were still somewhat resistant to catching the disease, we know now that it's not just about antibodies, that there are several other parts of your immune system that go into protecting you against either catching COVID or getting sick from COVID. T-cell, immunity, macrophages, a whole bunch of other stuff. So most of the tests, and they're not all the same, will look at a different way of looking for antibody, but a negative antibody doesn't necessarily mean that you're not immune. It's just that that's the way that they're currently using to determine immunity. And even if we look at some of the data that Pfizer would put out, or even the most recent data that came from August in terms of Cleveland Clinic that talked about previous infections and people who had previously been infected did not show any sign of being more infected over those who were vaccinated. A lot of times what they do is they don't go and test everybody's antibodies. They simply look at those people who are getting reinfected and try to come up with what makes these people different than the other people. So when Pfizer had their group of unvaccinated people initially versus vaccinated, and then they said, well, who came back positive? Then they were able to say, well, out of the vaccinated versus unvaccinated, a certain amount were vaccinated and a certain amount were unvaccinated. Not necessarily these people had antibodies versus these didn't. They didn't actually do that. They didn't go back and look at everybody's antibody test and see who had derived antibodies. They don't do that in general. That's one of the reasons where we're now coming to the point where they're thinking they want to do a third shot, not because they actually know these people don't have antibodies, but they're looking at previous people who have caught COVID despite being vaccinated. And they're trying to make the assumption now that these people had somehow lost their immunity. So we have to base it upon what is it about these people that make them lose their immunity? Is it the fact that there are autoimmune issues or they have immune compromise, any of that stuff? And then you will basically apply that to your whole population. They have yet to really come up with one antibody test that they can say for sure it either says you're protected or not. There's just way too many antibodies, especially for somebody who has natural immunity, because they're not going to have an antibody just against the spike protein. They're going to have antibodies against multiple things, which they're not even testing for.
All right, thank you, Dr. Darling. So this question is very interesting. And it appears that all these questions came from the same person. Do you feel that we should simply open up everything or go about the COVID crisis in a different way? What is that way where people are protected and personal choice is given in balance? So maybe all of you might want to have something to say about that. Anything, Dr. Frith or?
Well, Eugene, when we look at the nature of what's being said, what's being reported, and then meandering through what is factual, because that is getting very, very challenging. I know for myself, just trying to figure out what it is. So right now, like here is what I read on the Burn News site, and that would just be cases arising. And so if you're getting these particular cases and people are sharing with you the truths of their whereabouts and things like that and their particular status, I still find that there's like maybe a little missing connection for me in reference to, okay, this is with us. And if, the overarching message is to get vaccinated, which is a real thematic message that we hear all the time. And then we hear and understand that based on the data that is reported, that, those who are vaccinated and non-vaccinated can spread, what are the mitigating things that we actually can do as a community? What are they?
Okay.
I think that people should, we should encourage people's general health, which I think all of us are saying throughout the entire series. Encourage people's general health. That includes their baseline health or their constitutional health and mental health, because we've neglected that for far too long. And also, I think that we should ensure that people have access to healthcare. This business of minimizing time, taking calls, and then seeing patients face to face for the least amount of time as possible, getting rid of elective procedures. I don't think that that's an appropriate way to manage the community, because now we have people who are regressing in lots of other avenues of their health. COVID is a very minute part of the illnesses that exist. And I think we've spent lots of time on it, and that has been for good reason. And now that we see how it can be managed, the options that are available, we see success with vaccination, we see success with the use of ivermectin, we see that over 98% of people generally recover. I think it's time to learn to live with it and pull back from neglecting all those other health issues that exist. Deal with the sick people as they come and encourage prevention and general overall health.
Yes, give thanks. I
I'd like to echo those sentiments. I think this is a great opportunity to get back to basics. When I say basics, basic healthcare, basic common sense. For example, before COVID or these extraneous viruses, what did we do? When someone has a cold, basic influenza, what do? We protect ourselves from that person. You say, Johnny has a cold, so don't go around him. Okay? This is baseline healthcare. and even just being aware of that. So I think it's a great opportunity to go back to basics. What did we do in the past? Did you hear so-and-so has got the flu? Okay. So we tell so-and-so to go home, rest, and we check on them, etc. But you protect yourself. How did you protect yourself? You didn't go around them, hugging them, and hanging out with them, using the same glass or bottle that they drink out of. These are common sense things. And I think with all this hype around this, we are forgetting some of the basic health principles of healthy living. Yes, we talked about washing your hands, but too much washing your hands also can affect part of your immune system because you have a certain amount of bacteria that's natural to your body. Number one. Number two, a lot of these so-called hand sanitizers are actually killing your friendly bacteria, which is part of your immune system. So you have to be careful also when you promote, oh, just wash your hands, wash your hands, wash your hands. Because in fact, you're washing away some of your protective immune system, what we call the microbiome, your friendly bacteria. You know, not all bacteria is bad bacteria. There are some bacteria that is called friendly bacteria. So you also have to be careful of, and people have to be educated, that you have to be careful and mindful what type of hand sanitizers you're using. A lot of the shops, you go to the shops, they don't even have labels on those bottles. What the heck is in that? Yeah. And you have to ask, excuse me, what is in that bottle? And what does the gentleman say? I don't know what's in it, but I know I'm going to spray it on your hands. That is not acceptable. So a lot of times, you know, we take our own hand sanitizers that we know what's in it. So we're not destroying our own friendly bacteria. So again, echoing the sentiments, Dr. Assaron, we need to get back to baseline health, basic principles of health, and being aware and taking some responsibility for just being aware of your surroundings. You know, put your hand over your mouth when you cough and sneeze, and your elbow, what have you. If you know so-and-so has sniffles or colds, you just stay away from them. And if they get really bad, just like in the past years of flu season, cold season, you stay home, you call in sick. These are basic principles. You get better and you come back. But at the same time, before the symptoms actually manifest in that particular individual around, you've actually already been exposed. That is also building natural immunity because your immune system now has been exposed to the various, as Dr. Durling alluded to, various different other viruses and bacteria. All the attention has been on just one spike protein. There are many different kinds of viruses. Just like we have families, you have cousins, you have uncles and aunts of viruses, if I may use that in a humorous manner. So you're already being exposed, and your immune system is already working, and you don't even know. So once you can bring down the fear level and raise up the education level, then people can be a little more relaxed in the community. Right now, people have so much fear. I mean, you can't even sneeze because you had dust in your nose. People will give you a look. Oh, are you tested? Or maybe they have the big C. You know, and all these things have gotten out of hand. So I think adding to the baseline is to start to re-educate the community that, first of all, you don't have to be afraid of viruses. Viruses have been here before us, and they will be here after us. But we can exercise common sense and fortitude and awareness as we go about our day. But to walk around in fear, that is already compromising your immune system. If you see somebody coughing and sneezing profusely, you're not going to go in that area. You stay away. So baseline health, I think, is an opportunity to really get back to basics and then build upon that with education and communication and awareness.
Thank you, Sifu.
So numbers don't go down by letting people not move around and
Right.
keeping them, you know?
Yeah, not necessarily.
Yes.
I think Dr. Frith was trying to say something.
Yes.
Yeah.
It got answered, or I should say it got stated between Dr. Assaron and Sifu, so that's quite fine.
Sorry.
Okay, let's move forward. Oh, I'm sorry. Sophia, go ahead.
I think the person who asked the question wanted to know the way. So a suggestion would be to identify what is causing, other than the people who are genetically immunocompromised, what what foods, what products in our community are causing more of our unhealthy behaviors and causing our immune systems to reduce their robustness. Cigarettes, alcohol, fast foods, unhealthy foods. And the way could be to, instead of incentivizing an injection, but perhaps incentivize the healthy options. If you reduce your cigarette intake, reduce your alcohol intake, and reduce your unhealthy fast food intake, then you can receive money or something that is necessary for you to survive.
Mhm.
So a big shift in consciousness.
Right.
Different incentives. Yeah.
Yes, definitely. So
You
give
know,
thanks. So,
I was just, Eugene, just want to flip back to something that Dr. Asaran said about limiting contact with persons in the community that need medical assistance or health assistance. Certainly, I'm not quite sure whether I have antibodies, angel bodies, higher power God bodies. But the one thing that I refuse to do is to limit anyone coming into my business and having contact with that person. No, I'm not being irresponsible. Masks are required inside of the business, and people have questions. They have questions that are not being addressed by mainstream media and information being put out there by the health department. They feel isolated because they are not allowed to express these questions or concerns. And so, knock on wood for whatever kind of body, or maybe I have a combination of all those bodies, the antibodies, the angel bodies, the higher God power bodies, and bodies I don't know about. But I will not, under any circumstances, limit my contact with someone that comes in with a health concern.
Yeah.
yes. All right. Thank you very much, Dr. Frith. And I think all of this kind of sends us right into the next topic, which is around general health and wellness. And this is an interesting question that we have here. Have any of you seen evidence of persons experience adverse effects due to their proximity to persons who have been vaccinated? Maybe due to the transmission of spike proteins, etc., from those vaccinated persons. Any comments on that? I see a few hands going up. Did you want to talk again, Dr. Frith, or?
I'll let Michael go. I'll let Michael.
Okay, all right. Go ahead, Mike.
So this is purely anecdotal, and I have really no evidence to support this. But having gone from, not working, being in isolation for the best part of a month, I came back and I went back into my practice. For those who don't know, I'm a hands-on manual therapist, so I'm touching people all day, every day. And certainly for the first week of getting back into practice, having my hands on people, there's this exchange of energy going on. But the best way I can describe it is I would get back after my morning sessions and feel like in some way the top of my head is spinning, and then I'm extremely exhausted. I would say 90% of the people that I'm seeing right now have been vaccinated. Now, I can't put it down directly to that, but I know that this is not normal for me. This is not a situation that I'm used to in my own body when I'm working with people. So this, it really brought to light this possible effect that it might be having, being in that proximity to vaccinated people.
Yeah, I did have one person reach out to me, and he was actually, he's been selling an herbal treatment to help people. And he said that there was a massage therapist. So I guess similar to your situation, Michael, who was very hands-on with people. And she noticed that when she was dealing with a day with clients who had been vaccinated, she had similar symptoms to what you described. And if she had a day where the person she was dealing with had not been vaccinated, and she wouldn't have any of those symptoms. So it is something. I know that there are things that have come out in the media about with women and the menstrual cycle and the
Yes.
menstrual cycle becoming heavier. I don't know if you want to talk a bit about that, Doctor
Yes,
Fred.
Eugene. I mentioned even today on my radio talk show that there was a period there where within, say, a 2 to 3 week period, I had about 7 women come in complaining of heavy periods, very painful periods, severe dizziness and nausea during their cycle, um, heavy clotting, um, 2 cycles in a month. So these are some of the things that have been coming in to me. I actually had someone come in on behalf of a senior. I think she was 82 years old, and after having her second jab, had her cycle. So I don't know if Dr. Asaran or Dr. Dolan can comment on that. I thought it was quite strange. So I decided to check the NHS list of side effects, and having irregular menstrual cycles was listed, and complications with menstrual cycles was listed. So yes, I've had several women come in. It got to the point actually where I decided, I thought, gosh, how many women are actually having cycle issues with their cycle? And I decided to ask the question. You don't have to answer me, I said, but have you had the vaccine? And the answer was yes. So, not saying that the vaccine is totally to blame, but they, along with myself, found it quite strange that after having their second jab or even their first jab, that they were having irregular cycle.
Yeah, so it's very interesting. There's been a lot of anecdotal data, like you all have shared about this, and I know I had first heard doctors outside of Bermuda talking about this, and actually in our series in episode 9 with Dr. Leland Stillman, then talked about this as well. And like you, Dr. Frith, he was kind of first thinking like, what's going on? This is maybe it's just, the women are just reporting about some crazy things. And then he said he started to see it so many times
Mhm.
that he realized that it was all actually very valid. So let's move along now to pregnancy. What do you say to pregnant women who are wanting to protect themselves as they become increasingly vulnerable, who also need to protect their unborn child against COVID-19? Any comments on that? I see you smiling, Dr. Darling.
Everything is about risk versus benefit here. I mean, what is the risk of catching COVID? American
Oh,
Academy of OB-GYNs, they're the ones right now that have come down to say, listen, we think that pregnant women should get the vaccine because they're very concerned about the outcome of a pregnant woman who catches COVID. They won't speak to what the possibility of the vaccine might or might not do, because their focus is at the current time. They want that woman to not catch COVID, um, which I agree. Nobody wants a pregnant woman to catch COVID. There have been, obviously the data to show that it increases your risk of, miscarriage and the whole business. Um, but what happens to the woman who is concerned about the long-term effects of a vaccine? They can't speak to that because there is no data long-term, because the vaccine isn't out long-term. So they can only speak about, I need to protect you now, not protect you in 2 years or 4 years. Um, it, it's hard to say because, personally, I try to get a pregnant woman. I mean, listen, Bermuda has a luxury of observing somewhat of a protection that you do not find outside of our shores. We have the ability to wall off to a larger degree, not zero, but to wall off the chance of infection with, a good way of eating, a good way of keeping your diet under control, vitamin D, all of that stuff. So your need might be less than if you were in another country where you might be exposed to every Tom, Dick, or Harry. I personally think it has to be an individual conversation that you have based upon your risk, and I don't blankly say just step up and get the jab. I just can't do that. I just can't do that.
Yeah.
No matter the advice, I think it should be revealed that we don't know the outcomes. I don't think that safety should be declared when studies remain incomplete. And the same way that the risks of COVID in pregnancy are discussed, the risks with the vaccination in pregnancy should also be discussed.
True, very true. Yeah. I
Yeah.
mean, we what we do know now that we didn't know when they first released the vaccine was that spike protein doesn't stay in your muscle where they inject it. It does travel. We're very clear on that. We're not so clear to say what it does. So it might be what's causing some of these other issues with the periods and stuff. But we cannot say for sure. We know, it might go to your ovaries. It might go to the
There is,
testes.
yeah,
It might
there's
go to your brain.
bioavailability studies.
Will it do something? They don't know. But they can't. Before it was like, no, it stays in the muscle. So what they thought was true at the beginning is now shown not to be true.
Dr. Asaran?
Yeah, I was saying there's a bioavailability study, so definitely the studies show that it is present in other tissues, and the highest concentration was in the ovaries.
Yes. So, and I brought up this other question because Dr. Asaran, you start talking about practitioners declaring it safe, and this is exactly what this person was asking. Many health practitioners, I mean, we saw this in the newspaper recently, are vocalizing the safety of getting the vaccine while pregnant. Do you feel we have enough research on this topic? So I think
I mean, they were declaring safety before the trial in pregnant women even began. So I don't think there was enough research then. Definitely not. And there isn't enough now because the trials began in February and April for US and then UK. Which puts the longest time that's passed at March, April, May, June, July, August, 6 months. Pregnancy is 9 to 10, depending on how you count it, lunar months or what have you. But either way, you have at least 3 more months of data to tell you what the entire course of pregnancy is like with it. And then you have the puerperium period, the period after delivery, and then you have effects on the child that's born. There's a whole lot of time and studying, before you should declare safety, which is usually why things go into these lengthy trials.
Right. Exactly. So yeah, and unfortunately, there's been a lot of things that were declared at one point that now officials are finding themselves backtracking on,
and let me say that I think that in the beginning, it was the right thing to do at the time when we didn't have information, when we had no idea what was going on, and we desperately wanted to find a way to help our people. But now that we know a little more, we see that a lot of people are managing well. We see that the vaccine in those very vulnerable populations has helped in that regard. Then we can now use that data and spend more time trying to collect more data so that overall we're continuing to maintain patient safety.
So the next question is, how do you feel women in this position who are uncertain they want to get vaccinated should protect themselves? And I think some of you spoke to this already about general health, but does anybody want to add any other comments to that?
Pregnancy is a risk. Yeah, pregnancy is a risk. you do the best you can. You make the best possible decision based upon the data that you're given. I'm not going to fault a woman who decides to take the vaccine. I'm not going to fault a woman who doesn't decide to take the vaccine. That's their personal choice. I just think you shouldn't be bullying people. I'm getting way too many people talking about they feel that their doctors are basically bullying them into getting vaccines versus giving them honest. The reality is they don't know any long term, but I bet you they're not telling them that. That's the problem.
Yeah.
Right, right. All right. So now this is another one. I had sickle cell, I had stroke 9 years ago. My doctor advised me not to get the shot, and I haven't. Years ago, against my doctor's advice, I got the flu shot. 2 days later, I was admitted to KEMH. What is your take on people with sickle cell getting the vaccine?
Recommended.
People with sickle cell already have a different risk profile on thromboembolic events. There is definitely not enough data available on that I would never tell a patient it's safe in that circumstance. I wouldn't tell a patient it's safe in any circumstance, because I think that we need to consider that more research needs to be done. But I am happy to give patients the advantages of vaccination as well as the disadvantages. I do not try to sway them either way. But when you have sickle cell, you need to consider that you are already somewhat compromised. So extra care needs to be taken.
Right.
Either way, it comes down to patient choice. I would not sway a patient at all, but definitely remind them that we don't have specific data on that condition and the reaction to this particular medication or option.
Right. Okay. So that person they also said after they had the stroke, they never took medication or any natural herbs. Recovery was awesome. I can now walk and talk thanks to those herbal treatments. So they put that after the question, I guess, to also highlight how, other methods have been helpful to them in their life experience. Yeah. So if
The
you
other
had,
thing to remember is that herbal methods and treatments, that these are the ways that we created today's medications based on plants and herbs. So it's not far-fetched. It's not like witchcraft. It's not quacks who use those things. The medications we use today were created on the backs of plants and herbs. And if they aren't the actual agent in these plants, they are synthesized based on this agent.
And
Yes.
Eugene, if I can, just add this little piece in here. The U.S. Department of Health and Human Services, in conjunction with the National Institute of Health and the Center of Complementary and Integrated Health, featured an article on the 2015 Nobel Prize winners who are pioneers of natural-based medicines in actually October 5th, 2015. Dr. William Campbell from Ireland, Dr. Yo-Yo Tu from China, and Dr. Satoshi Omori from Japan shared the Nobel Prize, which marked a major shift in medicine for people suffering with devastating parasitic disease. And just to note, Dr. Tu's work or research was inspired by traditional Chinese medicine, which uses herbal medicines for the treatment of malaria. Her resources were taken from ancient Chinese herbal textbooks written as far back as 284 AD. With that research, over 1,000 lives are said to be saved in Africa every year due to Dr. Tu's research, and since the drugs were introduced in 1981. So I just wanted to let people know that, like Dr. Asaran said, it's not witchcraft, it's not pseudoscience, it's not not scientifically unproven, that herbs play a major role in many aspects of health. And you have people out there that are going to make a choice to go a more natural, less invasive way over pharmaceutical drugs because they've had some sort of adverse reaction in the past. And again, that is totally on that person. That person is making a choice. So just wanted to put that out there that we have, some members of the medical community. And certainly the health department will say, oh no, don't try anything herbal. It's not scientifically proven. When we have just tons and tons of science and that's been listed in medical journals for people to fall back on and research if they're interested. But most people don't want to go through that exercise. They would rather listen to someone that they can say is in authority as a medical doctor and should know this. Well, I don't know about Dr. Dolan and Dr. Asaran, but the last time I checked, I don't think you all had medicinal herbs or ethnobotany or medicinal plant anthropology included in your medical curriculum.
No, I will say at UE though they made us do the history of medicine.
Well, that's a plus.
Yeah, we did do history of medicine.
Right. So in other words, medical doctors aren't the only experts around.
No, they're not.
Yeah, everyone is an expert in their particular field, and it's all necessary in terms of playing a major role in helping to keep our communities and our families healthy and safe.
Yes,
that's a good segue.
And when we speak of the science, we must also be respectful and acknowledge that there are several platforms of science, and not just one, hierarchy of science. And many of those scientists and clinicians and researchers are going into the indigenous communities, as I've said before, to find out what the indigenous people are actually using to combat disease. And then they come back and they extract those active compounds from those plants. And like Dr. Asaran said, if it's not an active ingredient in there, a synthetic is then applied.
Yes.
Yeah, I'd like to add something too, if I may.
Yes.
Yes, it's interesting because Chinese medicine has been at the forefront of several of these pandemics. In fact, when they had the SARS, the swine flu, H1N1, bird flu, Chinese medicine herbal formulas have been extensively researched. But because they're not part of the allopathic paradigm, a lot of times these statistics and data are not permitted to be put into the major medical journals. So where I have tons of data about the formulations and all of the herbal medicines that have been used, but not just recently, but way back since swine flu, H1N1. These were the actual herbal formulas that were used, and they were spread. They've been used in Europe as well by medical community because they're far more open, particularly in Germany and France, if you want to know. And even for the COVID, we have herbal formulas specifically for that. One of my professors, who is a medical doctor, who has hospital rights in France, has used these protocols, and she's been trying to get these data printed into the New England Journal of Medicine, and they have refused it. The American Academy of Medical Acupuncture now is trying to take it on so they can try to get it published, because this is very significant data that is very recent as well as ancient. So when they had the bird flu and SARS, Chinese herbal formulas was the formulas that was used extensively in Europe. I just wanted to add that. And they've been continued to use because we also have very specific categories of herbs where they have been scientific. They have a whole pharmacopoeia of studies from chromatography to the assays of all the active ingredients. And they have been able to categorize herbs into antibacterial, antiviral herbs, antiparasitic herbs, and we have all the classifications very clearly outlined and dated, if anyone is interested in that. So as Dr. Frisch said, that I think this is also an addition thing that we can also look at, because it's not always just a pharmaceutical approach, because actually the herbs are drugs too.
Yes, they are.
And this is why I mentioned the last episode about people being internet doctors, and thinking, oh, it's just herbs. No, herbs are drugs. They do have medicinal properties. They do have a pharmacology. They have a pharmacopoeia, and you have to know not only the pharmacopoeia, but you have to know the action, indication, function, and also contraindications, just like medicines, because they are medicines, and also dosage and contraindications, and what's the drug-herb interactions, and this is all in our curriculum. So it's not just about looking up herb, this is good for that, and let's take that. No, you have to know the pharmacology, you have to know the physiology, you have to know the pathophysiology, you have to know the action, indication, function, contraindication, and also dosages. This is not a toy to play with.
And Sifu, I just want to feedback on something here. The World Health Organization, if you go on the World Health Organization site, they actually supported the use of folk medicine or medicinal botanicals for remote communities, and praised those who were able to combat specific diseases for persons in remote communities.
Yeah. And those doctors in China were called the foot doctors. So when you hear of traditional Chinese foot doctors, these were doctors that were trained to go into remote communities that did not have access to mainstream medicine. And what they had with them in these remote areas were acupuncture, herbs, moxibustion, cupping, bloodletting. And now even in Western medicine, now they're going back to using leeches for bloodletting, for toxicities and parasites and infections. There's specific points that you bloodlet. And now they use leeches. We use lancets to bloodlet certain areas. So it's very, very interesting and fascinating that these things are coming back mainstream. They're very big in Europe. There are over 20,000 doctors in an organization that I know, medical doctors, all the medical doctors that are using exclusively Chinese herbal medicine. The American Academy of Medical Acupuncture, you guys might want to look into that. They also have programs for medical doctors. They have a program for medical doctors at the UCLA in California. They have programs in Europe. And they have these conferences that are really showing the movement and the forefront and scientific data and evidence-based data of how effective the Chinese herbs are. And these are medical doctors who actually have had their practices revived, where they're about to retire, but they're so excited now and rejuvenated by now adding these paradigms into their practice. And of course, this doesn't mean you dismiss your medical training. You still need the medical training. And that's why I've said, again, that integration is so key to moving forward for the best interests for humanity.
Right. All right. Thank you very much. So this is the last question around health and wellness. And then, so we're going to try to pick up the pace. I think we're into our last half hour to try to get through that. So obesity has shown to be the most critical factor in determining the severity of outcome of a COVID infection. What can we do to address this unspoken issue? Anybody want to quickly address these? We're going to try to do these.
Rapid fire now?
Yeah, it's rapid fire.
Well, I'll just like to say it's very interesting. Not everyone that's obese is unhealthy, because some obese people, that's the structure of their constitution, and you'll be surprised that their blood work panels are better than some people that are thinner. So I think what we're talking about is obese people that are not in good health.
Right.
So we can't assume because someone is overweight, they're unhealthy, because some people have a very interesting constitution. If you look at their blood work, you'll be surprised. I don't know if any doctors have experienced that.
Yeah, not all obese people.
I think the issue becomes what they say is that there's been a high correlation between those who have been very sick from COVID have also had a correlation with being obese, and as well as one other factor. So obesity usually is linked to the ability to get well. Whether or not you might, it's like driving. Probably a lot of people who can drive over the speed limit, but the speed limit is based upon the average. You know, most of the time, what you're going to do is base it upon the average person and what the average person will either have as a problem or not. Obesity for the average person usually is not a sign of them being healthy, but a sign of them not being healthy. It's not always just physical unhealthiness, but sometimes mental unhealthiness. They have a problem with obsessive compulsive. They have a problem with sugar. They have a problem with whatever. So, you know, if you're not obese, your chance of not just catching COVID, but getting sick from COVID is correlated with a lower chance. That's all they can say at that point. They can't directly. That's one of the reasons your insurance companies a lot of time will not pay for any kind of test that's related directly to obesity, because they themselves will not be able to link the obesity directly with an illness, although it is highly correlated with an illness.
Right. So yeah, and just the second part of it is a lot of what you have already been talking about, you know, our constitutional health. Sophie, you talked about healthy living, looking at the different foods that we eat. You know, you and Michael are both movement practitioners, so obviously you're advocates for exercise and things of that nature, just like you, seafood. You know, Anthony, mental health, you know, all of these things are contributing factors. So I would say if you are suffering with obesity, then, you know, start to look at these things. Maybe not everything all at once, but just one at a time. Maybe you can even come and see some of the practitioners that we have here for assistance or guidance in that process.
I just want to say that I don't have a miracle tea for weight loss. I just want to say
that. Just letting everybody know up front. Okay.
Because they come in and they ask for it, and I don't have it on the shelf.
You keep it in the back room?
Yeah,
go ahead, Mike.
Yeah, just one thing. I always talk to my students about what motivates them to move, and what moves you, literally. And one of the big things we see with high-performing athletes, people that move for a living, it's a form of passion that they have about what they're trying to do. So if we're talking about people losing weight and becoming more active, the losing weight is almost secondary to the passion that drives them to move. So if they can find something that they can connect with, that they feel passionate about, it could be walking a dog, you know, it could be something as simple as that. But getting people to move from that place of being passionate, as opposed to coming at it from the place of something's wrong, that they're obese and they need to be fixed in some way. They're perfect as they are. They just need to move more and find what moves them even further.
All right, thank you, Michael. So we're going to move into the government vaccination program. So very quickly, the government has mentioned herd immunity and community immunity. If vaccinated people can still transmit and get COVID, can herd immunity be reached with the vaccine? I see a lot of smiles. Oh, Dr. Ossaran, let me see. I'm sorry, you were just on mute.
Herd immunity is a statistical number. So
which changes.
Right. And I think this is the next question. What is the science behind herd immunity thresholds that the government sets? Why did they recently signal an increase in that threshold? You know, so
it's a statistical calculation based on like infection rates, so how severe a virus is in the simplest of terms.
Yeah, if
so it's all based on modeling then. It's all
right.
based on taking past data and creating models and, you know, okay.
The more infectious a disease is, the higher the percentage of people have to be immune to it before you can break that cycle. That's why a lot of
Right.
times they'll compare it to, I think the most recent comparison they were trying to say it's just as transmissible as was it chickenpox? I think they tried to say. So whereas the original strain was nowhere near as transmissible, that meant you could break the chain pretty quickly. Now this one person might infect 10 people versus 5 people, so you need to have more people immunized through whatever way to break that chain.
And that's still
Right.
based on
It's still based on a
estimations
computer
and
model.
statistics and
Yeah, computer
Right.
model.
calculations.
Yeah.
So I think let's go back to this other question, because I think what this person is asking is that if the vaccine, if the data is showing now that the vaccine is not slowing down transmission, then is the vaccine actually helping us to reach herd immunity? Is herd immunity about stopping transmission, breaking the chain, as you say, or is it about people not getting sick?
Herd immunity is a number, a statistical number. So if you set it at 50 and you have 50 people with immunity, you're at herd immunity.
Okay.
Not saying that that's the most effective means of managing it, but that is
Right. Right.
I think the what they're really getting at is what do they mean by immunity?
okay.
So if you look at the definition, it's to basically resist a disease. So ultimately, how many people in your population will resist the disease? Now, does that mean resist catching the disease or resist getting sick from the disease? That's a good question, I guess. So
Right.
you could sit down and have a whole other conversation between that one, but
Okay. All right. So we're gonna keep moving forward, and I think you already answered this. Shouldn't natural immunity be counted towards this threshold of herd immunity?
yes, and yes.
Yeah.
Yes. Okay. Unanimous. That's unanimous. How can the government support a population-wide vaccination program when the data clearly shows that the vast majority of the population is not at severe risk, particularly children? I see Dr. Ossaran's facial.
I don't have an answer for that. I don't know.
Some of these questions, to be fair, I feel like they need to be asked to the government. But does anybody have any comments about this?
Well, I mean, a government should do for people what they cannot do for themselves. So ultimately, a government should be trying, not that they always can succeed, but they should be trying to help people resist disease. Now, whether that's through vaccinations and or clean water and or healthy diets and or reduction of stress, all of that goes towards making your population healthier. Vaccinations clearly have been beneficial, but they're not the only methodology. And if they try, what's been shown recently is if you try to just do vaccinations, it's not going to work. They got to try other stuff.
Right. Okay. So, Dr. Ossaran, you had a question.
Oh, someone asked me a question.
Someone asked, it said, can we discuss why the age of testing was decreased to 2? I know I wasn't aware of that. I don't know if any of you were aware, but do you want, and I think there was a bit more to the question as well. Did you want to talk a bit about that, Dr. Ossaran?
There was someone who sent a comment that they returned, they had their infant with them, there was no qualified medical professional to perform the test. They did not wish to agree to one of the other staff members doing it. They felt like for their child, it should have been a medical professional. So they were upset that that person was not available and not stationed at that place to do so. And then they also asked why the age of testing was decreased to 2.
So are you saying that we're now testing 2-year-olds upon arrival to Bermuda?
2 and above, yeah.
I didn't realize that. Did that change recently, or has that been the case for some time now?
I don't know the date that it changed, but initially I think it's no one under 10 was tested, and now it's no one under 2.
Wow.
I mean, I feel like you guys do know that testing, you have to provide consent for testing. You know that, right?
I'm not sure that everyone does know, so I
Yes.
think you should speak about
Well,
that a bit more.
you must provide your consent for medical procedure like that.
So in other words, it's not, you don't have to take it. It's something that, it requires your consent in order to.
Remember in the beginning when all this was implemented, if you did not wish to be tested, you simply went into quarantine. And if you did not wish to test out of quarantine at day 14, then you simply got a further 14 days. That was it.
Okay.
But
Now,
all procedures require your consent.
Now remember, if you're not from Bermuda, you need a test to even get on the airplane. So that means you might say, I choose not to be tested, but then the airplane will choose not to have you get on their airplane.
Okay.
And it's not a Bermuda thing. That's a CDC thing.
So is that for like 2-year-olds then?
2 and above. If you go on the CDC website, it's 2 and above. Now, I'm not sure what methodology they use to test a 2-year-old. Children, I thought was mouth, but even that is for a 2-year-old to actually.
Yes, invasive.
Yeah,
uncomfortable.
They're not going to open their mouth and go so.
Yeah, that's very interesting. Okay.
I would imagine the reason they decreased it is because of increasing cases, the fact that they know that there have been positive children. But I think in considering that, we should also still remember that the younger children have decreased or less severe responses, if any, because a good proportion of them have no symptoms.
Right. And still the likelihood of them catching it is still less than an adult. So if you think about a 2-year-old, the chances of, if they're already less likely to catch it, what's the chances of a 2-year-old having COVID and not one of their parents? I mean, that would be an extremely rare case. So if I have a positive 2-year-old, I'm sure one of their parents have to be positive. I'd be more worried about
point, I suppose. The other thing with saying that is for people to remember that the tests represent a point in time only. That moment that you are testing, that's all it represents.
Mm-hmm. Very important. Okay, so we're going to move into adverse effects and informed consent, which are the last 2 topics. So the rate of adverse effects in various collection systems worldwide has been extremely high and likely severely underreported. Are we collecting the statistics in Bermuda? I think in our first media conference, Sophia, you had some comments about that. I know that we talked about the fact that the hospital had established someone in June, I believe it was, to start collecting data, but you had an experience, Sophia, that was kind of contrary to that?
Yes, I called the hospital 3 times to ask for Nurse Sylvia Robinson, and they didn't know who she was, and they didn't know how to direct me. In fact, they went into panic mode and directed me to the place where the injections are given. And when I spoke to a staff member there, they just said, call your doctor. We just give the injections. We don't record anything that's gone wrong with the injections. You have to go and talk to your doctor about that. That was the statement that I got.
Okay, very interesting. So we do have someone at the hospital, but it's still not clear,
No.
I guess, how robust that system actually is at collecting. So the next question is, should the local statistics on adverse events be made public? What are your thoughts on that, everyone?
Yes.
Yes, they should.
Yes,
Yes,
absolutely.
indeed, they should.
People should know what's going on. We had no problem letting everyone know how many cases, where the patients are located, their outcomes. Why wouldn't you say the outcomes of this one thing that you're promoting?
Right. So the next statement, the number of severe adverse events, including deaths, have been higher for these vaccines than the sum total of all other vaccines combined over the last 30 years. Why is that not a signal to stop the vaccination programs, at least for cohorts not at risk, like healthy children and young adults? Any thoughts on that?
It seems that governments are responsible for pushing the programs, but usually governments are responsible for pushing those types of programs after they've already gone through the rigorous process of trials and testing and listing of adverse effects. We're now doing that simultaneously. We are pushing the program and trying to figure out the side effect panel at the same time, which most doctors have never done because most doctors are involved in, they're rarely involved in drug discovery, clinical trials, or medical research. For the most part, they are treating patients in the offices, which is an entirely different and separate environment.
Okay, thank you very much. Moving on to informed consent. What is informed consent and is it being given in Bermuda? I feel like we're on a game show now. I'm
I
sorry.
feel like I'm answering all of these and I don't want to be the only one that's speaking.
No, that's fine. I think everyone's had a chance to talk, but you and Dr. Darlin are the medical doctors here tonight, so and we love our
Informed
medical doctors.
consent is centered around the idea that you are giving people all the available information. You are discussing with them all the procedures, processes, the risks, benefits, and offering alternatives. That is the basis of informed consent.
Well, we're,
Hmm.
we're
And you are
falling
given
short.
that information, you are given that information to your patient while still upholding the other principles of medicine, which include autonomy, which means the patient is the person to make the decision based on all the information that you provide, because this is your field of expertise, not you making a decision for the patient or you only giving one small portion of the available information.
Hmm. Dr.
So when you
Frith?
go for surgery, informed consent looks like we're going to do this procedure to save this part of your body. In doing so, there is a risk of infection, disruption to other organs that are not the intended site, an allergic reaction to materials that we are using or any anesthetic agents that may be used. The list goes on. And then they also tell you there's also a risk of death because there's all the risks associated. That is usually how consent is provided. And your
Hmm.
patient signs to understanding all the things that you've explained. That is why it's very easy for people to go to have malpractice suits, because if you forget and leave something on the off the list, and that patient says you didn't tell me about this, then they have a grounds to sue.
Okay, thank you very much,
So,
Dr.
so
Asman.
we have a lot that's being left off the list, Eugene, in terms of information, particularly with people that are at high risk for medical conditions who should be exempt, an exemption list, identifying specific illnesses or underlying health conditions where you are putting people at risk simply because we don't have enough data to cover those bases, all of those bases. I can go on NHS and I can find a list of people who are medically exempt and the risk factors that may possibly occur as a result of them taking the vaccine. None of that information is made available to us here in Bermuda. So I think that we're doing a disservice to our community by not informing them that with an underlying condition that they are actually putting themselves in harm's way. We have medical doctors locally that are encouraging people with underlying health conditions to get the vaccine and telling them that it is safe. It is totally safe. And we know that we don't have that information to confirm that it's totally safe.
Mhm.
So we're missing out a lot of information that would actually help someone make an informed decision.
Right. Thank you.
There
All
are
right.
cases where informed consent, you can have things like implied consent. So just so you know, if you want to be seen by a doctor and you make an appointment and you show up to that appointment and you sit in the chair in front of them, that is implied consent, right?
Mm,
You've gone through all the processes. So not every um, instance in medical care requires informed consent, but there are tons of instances like the distribution of certain types of medications or specific procedures that require informed consent.
and this is one of them.
And Pfizer does have a sheet that's supposed to be presented to the recipients of their vaccine that actually goes through this. I don't know how many people who have had the vaccine have gotten this sheet. I don't know how many of them have read it. Simply giving them the sheet is not informed consent.
Yeah.
You can't hand them the sheet and say, "This is the sheet. Read it over and sign it." And then sit there in front of them and say, "Okay, you signed it yet? You signed it yet? You signed it yet?" I mean, right on their seat it says the Pfizer COVID vaccine is an unapproved vaccine that may prevent COVID-19. So every time somebody gets on the air, no matter who they are, and say, "This thing is approved," it says on their own sheet, it is an unapproved vaccine that may prevent COVID-19. There is no FDA approved vaccine to prevent COVID-19. So they're saying it. You can't come back and say, "Well, somebody told me it was approved," when you supposedly had been informed, informed consent, that it wasn't approved. It says under the list of side effects, it goes through the whole list. It has a long list of potential side effects. And then they also put right at the end, these may not be all of the possible side effects. Serious and unexpected side effects may occur. So that's a nice way of saying death is still part of it. So as long as people understand this, and you have to ask them, have you read through it? Do you understand? Is there any question that I can ask? That's the only way somebody's been informed. However, that takes way too long because you got a backup of people waiting for more vaccines. So that's why most people just get rushed through, don't even remember signing something or looking at something. And yet, if something happens, the people who give it to them are held not liable because they were informed that this was their choice and that they knew all about the potential side effects. Potential.
Right.
So
Okay.
Coming from somebody who's not an anti-vaxxer, by the way. I'm actually waiting to get a vaccine, just not this one. So,
So, Dr. Burling, my question to you is when a physician tells someone that has an underlying health condition that the vaccine is perfectly safe, and they then have an adverse reaction to that vaccine and possibly wind up in hospital, as I know several people have, how do you roll that back? How do you roll that person's health, that you've compromised that person's health? How do you roll that back?
Don't.
I you know what? For one thing, the physician that says that, they have to be really careful because you are kind of contributing to the whole idea behind that it's completely safe. You're almost putting yourself in a position of being liable to telling the patient something that wasn't true. You have to be very careful about that. You should say, well, as far as we have been told, you have to be very careful about doing something like that because here's the reality. I didn't make the drug. I'm not making money off the drug. And yet I potentially can get sued for telling my patient, "Oh, nothing's going to happen. Go ahead and get it done." and then something happens, because we know it can happen.
Yes.
So they have to just be really cautious. I'm telling them, because I
The
really don't want one
Pfizer
of.
fact sheet does not say this is safe, by the way.
Yep.
And the Pfizer's fact sheet also makes it clear that it's experimental. And that's another comment that comes from people a lot, is that this is not experimental when it actually is. Seafood, did you have a comment?
No, I had a question also. Is there a line in Bermuda for physicians that crosses malpractice? Is there such a thing as a malpractice line that will be crossed?
Ooh, that's such a broad question, because it depends on a circumstance or whatever. Ultimately, I find it odd that sometimes people go to doctors that they actually don't trust. First of all, they just keep going back and back, and yet, at some point, that's what leads to these kind of things. Doctors make mistakes; they're not perfect.
Sure.
None of us are. And if they think they're perfect, they've crossed the line themselves. And if you are a patient of theirs who keeps thinking that, hey, I'm going to get something out of them that's going to fix me. No doctor cures stuff. There's something a lot bigger than any of us that cures stuff. We just try to hook you up with the system that cures you, but we're not the curer.
Yeah.
But if you really have issues with a physician, you can actually go to the Bermuda Medical Council and voice your concern, and take that up with the group that is responsible for giving us our license.
Right.
So I have a question. I had a query that came my direction that said, my medical professional, my doctor will not see me unless I'm vaccinated. Does that cross a line?
Yes, that is unethical.
Wow. I haven't heard of that before.
have.
Simply transfer your file. Say thank you and move on. Why would you want to be with somebody like that? You don't want my business? There's enough. There's way too many doctors out here. You could find another doctor.
You are taught in your training that patients are meant to be universally treated the same. You shouldn't handle an HIV patient any differently than you'd handle a not HIV patient.
Yeah, you put
It's
on
called
your
a Hippocratic Oath.
jump in. Yep.
Yeah.
It's universal precautions that are meant to be taken.
Yeah. Some months ago, possibly in May, I know I was on the radio and I talked a bit about leadership and how the turn of leadership has an impact on the society or the population being governed. And so
Absolutely.
these things are literally being born out of a scenario where it's like, do as I say, not as I do. So in one sense, the government is telling people not to discriminate against persons because of the decisions they've made, the medical decisions they've made, but that same government is actively discriminating against people for that said reason. So the concern that I expressed on that radio show months ago, I think this was in May, was that people were already feeling comfortable and confident to discriminate because of what they were seeing from the leadership. And it appears that that's just continued to grow. So while we may be surprised at the fact that doctors are saying things of that nature based on, people being fired from their jobs and things of that nature, unfortunately, I'm not surprised at all that doctors are doing that. And I think it's a great point you made, Sifu, about this line. And also, Dr. Darling, thank you for sharing the information about the licensing board, because when people are experiencing these things, a lot of times they feel powerless and they don't know where to go or who to talk to or, what to do. Yeah. So this one, given that the vaccines are still experimental and no long-term safety data exists, how can risk disclosure and informed consent requirements be met? Yeah.
That's the whole idea behind emergency use authorization, is that you give people an opportunity for a possible treatment based upon the data that you know. That's all you can do. And if they're willing, knowing that there's limited data, to still take a risk, because remember, this isn't just applied to vaccines. There have been situations where there are cancer treatments that were still in the pipeline and people couldn't wait, 5 years for the treatment to be officially cleared. They wanted to take their risk. They had no other hope at this point in their life. They wanted something. Something was better than nothing, based upon what was their risk of getting sicker and dying. That's the whole concept behind it. If in an emergency situation, something is better than nothing. And this is what this was supposed to be for, because we had nothing. But once you have something, the emergency use is supposed to go away. And then you're supposed to get in line with everybody else. And that's where we're kind of finding it a little bit fuzzy now, because we're hard pressed to take that away. Because all of a sudden, if something comes up that's going to be as good, if not better, then you have to get in the line like every other Joe and Blow. And that's a lot of money going down the tubes.
Mm-hmm. So shouldn't people be made explicitly aware that they are taking part in an experiment and that they are part of the study group? I think based on what you guys have said already, then yeah.
That's why they should be listening to Beyond the Pandemic.
Exactly. How does participation in the experimental vaccination program impact health and life insurance policies? That's a big one.
They should take
We
that
don't
up
know,
with
but usually policies have a clause that make a statement about the use of experimental and unapproved medications. They're usually not covered.
I know ivermectin isn't. They're not covering ivermectin because they say it's not officially been granted a clearance for treating COVID. So why wouldn't any fallout from another drug?
Well, isn't that in itself unprecedented?
Yep. But insurance companies can do whatever they want. This is where you'd expect people like the Bermuda Health Council to step in and say, listen, you have rich people who can afford to pay for it and poor people who can't. They're all paying health insurance, and yet you're saying that you're not going to cover this because of somebody who has COVID.
Right. Okay. So, all right. Thank you guys a lot. This has been great. I think we're going over by about 10 minutes. There were a few other questions that came up. We've had over 120 something comments. And everybody who's been making the comments, I'm sorry, we had so many questions that we wanted to ask from the last time we did this that we didn't want to get distracted in the comments tonight. We'll do our best to get everything covered. I'm looking at a few others, just a handful of other questions. If you guys are able to hang on just a couple more minutes, that persons had asked. I'll try to go through these very quickly.
Eugene, before I just want to make sure, because I would feel really bad that people don't understand that they actually have some kind of control here. Vitamin D has shown to be great correlation between not getting sick if your vitamin D level is high, or at least up and at a good level instead of too low. So I really encourage people to make sure that they take vitamin D, even if they don't know their level. It's not going to harm them at this point to take vitamin D. It's going to be at least 2,000 international units of vitamin D3 because it's been clearly shown to help your immune system in general, and all the technicalities I can't get into here. But something as simple as gargling regularly with things like the Listerine that uses the essential oils, eucalyptus, menthol, thymol, all these things that have clearly been shown to help reduce viral loads within the mucosa. They can do that 2-3 times a day just to keep any possibility. If they suck down a little virus and it's just hanging out in their mucus, it can easily be destroyed. If they get betadine, which is usually over the counter at like 10%, diluted down to 1%, they can actually do nasal rinses with that to help clear their nasal passages. These are things that will clear on a regular. They have control over that. No government can stop them from doing that. No insurance company is going to, charge them a lot of big bucks from that.
If you talk too much about it, they just might.
Yeah, I should go grab some off the shelf before I go to talk to it. But yeah, these are simple things that you can do to help keep your spread down amongst your population.
Right.
And Eugene, I just want to add that, for those persons out there who cannot afford ivermectin, that's one of the reasons why people come in for herbs that have the chemical composition of ivermectin. My opinion is, if I can get a plant that has pure extract in it, why would I want a synthetic? That's just my opinion. That's just me. And that's not to discourage anyone from taking ivermectin. But if you can't afford it, please know that there are other ways that you can protect your immune system and have a similar effect to ivermectin, and that's been clinically documented. By the way.
Right.
And I'd just like to add, consult people that are qualified.
Yes.
It's very important,
Not
Yes.
Dr. Google.
not Dr. Google.
Yes. Okay.
What
So-
we're giving last notes? Because if we are we?
No, I'm just got a couple. It's just a few quick questions that came up. I recall a local info medical segment. I think this was a government segment describing the ingredients of the vaccine. It was stated basic salts and fats. Does anyone know what the ingredients are? Is there any fetal matter, any heavy metals involved in it? Is anyone aware of that?
In the declared ingredient list, those are not listed, but there are 4 lipids, which are fats. 2 of those, according to the UK Medical Regulatory Agency, have never been used for human medical consumption. So I think that's important to state that even though they don't list any heavy metals or any fetal matter, we still have not used 2 of those 4 lipids for human medications ever before.
Right. And are, just a general question very quickly, are pharmaceutical companies required to list every single thing? Because I heard you use a certain term about the ingredients that were shared. So it almost like it implied that there are other ingredients that are not shared. Is that the case? Is that what we expect? That we don't get like the whole list of ingredients for pharmaceuticals?
Well, there have been in the past some different terminologies used. For example, thimerosal. But what actually thimerosal is a mercury derivative. And there are other compounds that are listed with other names. I don't know how they got thimerosal for derivative of mercury.
Right.
So that's one example. There are many examples where they use other compound names, but because you don't know the compound name, you don't actually know what the derivative is from.
Right.
The same thing with like skincare, when they use actually petroleum byproducts, but they don't say petroleum. Or you wouldn't know that petroleum, or even the mare's urine, is used in your shampoo and skin lotions. And why are they used? I have no idea.
Right. Okay.
The 2 mRNA vaccines do not use fetal cells. The other ones do use fetal cell lines in the production. So that potentially actually is a religious reason for those who do not agree with that to, not take those particular vaccines.
Okay. So this person's asking, can we talk about graphene oxide in the hydrogel that's used to deliver the mRNA into the cells for this vaccine? Is anyone familiar with graphene oxide?
Ooh, that's a new one. Got to put that on my list.
You're gonna have to put that one on your list. Okay. Well, and for anyone listening, if this is your question, then we'll do the additional research after this if the question is not being able to answer right now. We kind of went over this, but are the adverse effects being reported? If so, where? I think this means listed. Can we find the adverse effects anywhere, or is this something that we need to pursue government about? Oh,
Pursue government.
okay, all right.
Melanie Dupre and I are answering calls daily, and we have our own list, but we're not actually giving the injections. The people who are giving the injections should be responsible for the adverse effects.
Mm-hmm.
Right. Okay. If testing positive, can patients get the monoclonal antibody treatment? I'm not sure what that is, so I'm going to need you guys' help with that one, if anybody knows what that means.
So I don't know if monoclonal antibodies have been officially given sanction yet, period. If they have, they would only be available within the hospital context. And for them to really be worthwhile, you'd want to take it early on in your illness, not later on. That's where you kind of, it's not going to be as effective, if at all. I know there's been talk about using monoclonal antibodies. You know, you could easily, if you came to me and I said you got tested positive, we could get you some monoclonal antibodies to try to basically do what your own antibodies would have done if you would have gotten a chance to develop them yourself. This is basically a shortcut to getting antibody treatment of your illness without you developing your own.
Okay.
But I don't think we are there yet.
Okay. So next one. Why can I not get antibody testing from my GP? I've asked 3 GPs and they tell me the government isn't allowing this test at this time.
So the only antibody testing is done right now is at the hospital. So the government, the doctors can order it, but they can only order it from the hospital. They cannot bring it in themselves. Some of them were trying to do that at one point, but between the government and the Bermuda Health Council, they clamped down on the testing outside of the hospital only.
So it's available still, and you can go to your GP to get the blood drawn.
You have to
if they
pay
offer
for
that
it, though. I
service.
think you pay out of pocket, though. I don't think it's covered by your insurance.
Right. No,
It's $27.
it's $27. Okay. So 2 things I would say. I was told, well, okay, there was a period when antibody testing was being offered. There were 2 places in particular. I know North Shore Medical was one, and I can't remember the name of the other facility that was advertising. And then recently that was shut down. I was made to understand that the reason it got shut down is because all the antibody testing kits are owned by government. And those facilities were using government's antibody testing kits to get the, I guess, the samples and then handed them off to government where they were being sent overseas for testing. And government pretty much said that they're no longer allowing people to use their sample kits anymore. So based on your comments, Dr. Darling, are you saying that individual practices are unable to get their own kits to facilitate their own practices at all? That's been disallowed?
As far as I know, I could not go and source out some antibody tests and bring them in the island. They would be confiscated.
Okay.
Wow.
Does anybody know the reasoning for that? Or
You can try call your Minister of Health, ask her to explain it, ask your Chief Medical Officer, ask Dr. Braithwaite at the Bermuda Health Council. Those are the
Okay.
people who control your health care in the island right now, not the doctors.
Okay. And so we answered this. The antibody tests are being done at the hospital and you can go through your GP to get them. Now, the other thing I was told is that new conditions have been put in place about the antibody test. So is that correct? Can anyone just get an antibody test now, or do you have to fall within a certain criteria now based on, okay, so you're not aware.
I think I've ordered one up until like last week. I simply put the person's name down because they have to, they send it overseas. I don't think they actually do it locally.
Right.
But they just facilitate it. So they're the kind of, gatekeepers of the test.
Right. Okay, I'm sorry. And I'm going to make this the last one. This is kind of something that's kind of new. Do you support the draft plan of masking all school children all day indoors?
No.
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 Don't even have to answer that one.
Yeah, you don't even have to answer that one. Yeah. I think that was it. There's one more last thing I see here is someone's asking, are the tests safe? The PCR test safe? do they potentially contain any chemicals that could be harmful? Is anyone aware of?
A
There was
PCR test is not what contains the chemical. They would be talking about maybe the things that are used to collect a sample, which is not PCR tests.
Okay.
I think they're talking. There was some talk about the swabs and something that the swabs were either sprayed with or whatever the case may
Like
be.
ethyl oxide or something.
Right, and that actual ingredient itself was potentially harmful, or shown to be harmful. I haven't seen a whole lot of other information on it. However, I think I had one person who basically said that it wasn't actually dipped in, it was sprayed or something like that. I don't know whether that would actually have an effect or not, to tell you the truth. So,
Right. Okay. All right. Well, I want to thank you guys. It's been quite a marathon. I appreciate you guys hanging in there. I thank you for the audience that's hung in there with us. We've done our best to kind of share as much data as possible. I appreciate you guys answering all the questions that were in. We'll be looking through the comments that were made to see if there are any more questions. But I would also encourage anyone who is yet to see all the episodes to go to beyondthepandemic.tv and watch each and every one. All of the health professionals who we have interviewed have shared information that's extremely valuable. Everyone has their own unique story. Everyone's expertise is different in some way. And so, although you may have seen some of the episodes, it's definitely valuable to see them all. At this point, I want to just open it up for all of you to make closing comments. We can start with you, Dr. Sifu Reginald Can. Any closing comments to the audience?
Thank you. As I said earlier, I think it's a good opportunity to get to baseline health practices. Keep open communications with your doctors, get your blood work and your tests regularly, and keep open communications about how you're feeling. Don't wait till you feel really bad to try to catch up with that. Mm-hmm. And use some common sense and basic things. You know, your hydration, as Dr. D said, taking your vitamin D, C, get fresh air, take your shoes off, ground into the earth, walking barefoot at least 20 minutes, moderate exercise, fresh air as much as you can, and sunlight. And, you know, clean up your diets.
Okay, give thanks. Dr. Frith, closing comments.
I kind of want to just go back to something that Sifu Khan said earlier about petroleum products and why use petroleum. One would never think of petroleum as a substance used for healing. Arab physicians were advanced in chemistry and perfected a formula that worked to address many health conditions. Medicinal uses for petroleum can be traced back some 2,000 years ago. This substance is also known as water white naphtha and has been administered in small doses to soothe asthma, relieve symptoms associated with arthritis, coughs, cramps, and upset stomach. Further uses include as an antidote for poison and a laxative, and as a remedy for skin rashes and infections. Well-known petroleum products produced include Vaseline, Vicks Vapor Rub, and mineral oil. All these products listed were a staple in Bermudian households as a go-to remedy for imbalances listed above. And Vaseline was formulated actually in 1837 and was used during the Civil War and other wars to help heal wounds. So there is some therapeutic benefit to using petroleum.
All right. Give thanks, Dr. Flood. Anthony Peets, closing comments.
All right, everybody. Indeed. Well, you know, great health is mental health. And so I want people in the listening audience just to make sure you take care of you. Get outside, socialize, do things that you enjoy, eat healthy. And I think one of the things that we can do as a team is just to synthesize some of the things that we've said so that people, instead of just hearing, they can also just see and take a look at all the things that they can consider. So take care of yourself.
All right. Thank you very much. Dr. Asaran.
I would just like to remind people to have respect for patients and other people's medical confidentiality. I think this pandemic has somehow made people feel comfortable with asking very personal questions that they don't need access to. So it's not appropriate to walk around asking people if they've been vaccinated, because there are genuinely people who cannot be vaccinated. And so that makes things rather uncomfortable on top of it being inappropriate. I think that people should also remember that medicine is an extremely dynamic specialty. It literally changes daily. You can see that by the things that we're being told today versus what we were told last year. Um, I think that medical professionals and the community should remember that the data from vaccines that we've historically used is not automatically transmissible to this particular vaccine, just because the risks were set at a specific rate for those other vaccines doesn't mean it's equivalent to these current to these current COVID vaccines. Um, and so that we shouldn't discount that the risks may be higher, that there are adverse effects happening, um, instead of making people feel like that is imaginary or not real. And I hope people remember to their overall health, which is what I spoke to earlier. And mental health is an important part of that. Um, so make sure that you have access to healthcare.
Okay. Thank you, Dr. Asaran. Michael and Sophia?
So just for me, I think in these times we tend to lose sight of ourselves very quickly, and I think it's a really important opportunity to really practice that attitude of gratitude. Try to remember what's in front of you and what you have, and remember to celebrate those things rather than spending all day, every day worrying about things that you don't have control over.
Thank you, Michael.
I'm gonna read on behalf of Melanie Dupre, Bermuda's homeopathic practitioner, in an effort to be unified and in an effort to heal, to better the health of ourselves and our community. We all deserve to take a look at our baseline level of health. There is absolutely no point in taking a jab or a shot and ignoring our already undiagnosed or diagnosed chronic conditions. That's from Melanie. And I just have a comment to say that the situation that Michael and I have put ourselves in is to reveal and to challenge everything that is happening. And the trial date is in November. So to our Bermuda community, if you would like to see anything brought to trial, please be in touch with us. If you want to hear anything clarified, now is our time. So please reach out to us, and we will make sure that it is no stone is left unturned in this matter. So please reach out. Thank you for all of your support.
And Dr. Darling.
So, there's been a lot of back and forth that have gone on between newspapers and people and their bosses and people and, their community. And what we have to remember that this can't be about being anti-vax or anti-Ivermectin. This is about, people's basic human rights to pursue their health choices without interference from government or from people in authority over you. They try to make it and shape it that you yourself would have an effect on somebody else's health. But what we know to be a fact is that we only really have an effect on our own health. And so as you decide to either have a vaccine or not have a vaccine, to take something that has not been FDA approved, make sure you've done your research, make sure you ask your questions, and then make your health choice, and do not let anyone else sway you from your power to do that, whether it's because of their economic power over you or your political power. That should be something that no man holds over anybody. And that's all we want here is people to have the freedom to make choices, whether we agree with them or not. Choice is a fundamental right that we should be getting here. Amen.
Well, give thanks, Dr. Darling, and once again, thank you to all of you for sharing your time this evening. It's been a journey. It's been 2.5 hours, but it's required that, the fact that it actually took 2 sessions to answer the questions that we received last month from the community shows how many questions there really are in the community and why there's a need for us to share more information and for everyone to be involved. This is something that will require all of us to get beyond. And the more that we can work together in this manner, the more that we can share, the more that we can empower and educate each other, and the stronger we will not only be as individuals, but the stronger we'll be as families, communities, and a country at large. So thank you guys once again. Thank you to all the viewers. We really appreciate you coming out and listening to this information. Anyone who has missed this in your family or circle of friends, please let them know that it will all remain on our Facebook page, on our YouTube channel, and you can always access any information from Beyond the Pandemic on our website. Thank you. Please send us any suggestions that you have to our email address, and encourage everyone to watch all the information that's been shared by the practitioners that we've interviewed. Just to let you know that our next series will be about the economic impact of the pandemic. I'll let you know that we are currently doing something called Community Conversations. That's something that we're doing once a week. We're doing online interviews with various people in the community just to talk about the social impact of the pandemic. And our next series is going to be on the private sector and entrepreneurs. So look out for more information about that. I don't expect this will be the last that we will talk to our health professionals, but we're going to give them a little break and talk a bit more about the other aspects of the pandemic. So thank you again for joining us, and all of you have a wonderful evening tonight. Peace and love.